If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what.
Well, new questions today about that now famous promise from the president. Two major American employers have announced what some call a, quote, radical change in how they provide health benefits to their workers. Sears Holdings Corp. And Darden Restaurants Incorporated, which owns chains like Red Lobster and Olive Garden, are now dropping company-sponsored health care coverage, and instead they're giving employers a fixed sum of money, allowing them to choose their own medical coverage. So let's debate this. Steve Moore, senior economics writer for the Wall Street Journal, Dr. Sridhar Podaratsu, CEO of Vital Springs Technologies, and author of Get Off the Dime, The Secret of Changing Who Pays for Your Health Care, and Simon Rosenberg, president and founder of the New Democrat Network, also a former Clinton campaign advisor. Gentlemen, thanks so much for being here. Steve, let me start with you. So places like Sears and Olive Garden, Red Lobster, they're going to give their employees a chunk of change, and then supposedly you can go out and buy your own insurance. Is this a great idea or a horrible idea?
I actually kind of like the direction here of basically saying to workers, you can shop around, you can buy the health care plan that really suits your need. So it's a kind of a freedom of choice approach. Now, the way this ties in, by the way, Allison, to Obama's health care plan that you were talking about a minute ago, is that under Obama's plan, what you're seeing is a lot of employers are dropping their health care plans that they provided for years to their employers, and they're going to put those workers into what's called the health care exchange under Obamacare. That's something that workers are really resisting because it means they're not going to get the kind of quality of care that they want. The idea of giving people a wide range of options, though, as these two companies are doing, I'm fully supportive of that.
Okay, Dr. P., what about you? Are you as sanguine as Steve Moore is about that people, this is just competition and it will help and people will be able to make their own choices with medical care?
In the ideal world, competition and choice is great, but history will tell us that many employers have already tried this. They've already given employees fixed contributions, and it doesn't work. It doesn't work because you can't give the same amount of money to every individual. It doesn't work because the wrong people end up selecting the wrong kinds of plans. So if you're somebody with diabetes and high blood pressure and a lot of medical problems, you need to be smart enough and know enough to know which plans you're going to pick. Otherwise, what happens? Costs go up. You end up not having the money, not having the benefits when you need them, and then if you can't get the benefits or the coverage, what happens? You end up back in the emergency room. So while this notion by Sears and Darden may seem innovative, there's a lot of companies that have defined or tried this defined contribution plan before, and it hasn't really been that successful.
Simon, what happened to if you like your doctor, you can keep your doctor, period? If you like your insurance carrier, you can keep your coverage, period?
I think what the president was referring to is that under the ACA, his health care reform, that there was nothing he was going to do or that they were doing that would push people out of their own health care plans. There was nothing the government was doing, and in fact, the fact that the private market is innovating in this way, and whether it works or not, we'll find out, is a sign that this was not a government takeover of the healthcare system, as you've heard, many people say over the last couple months. I think what we need in this healthcare, and I think the president has begun this, is we need more innovation, more efforts to give people more choice. We've got to control costs, get more people on health insurance. And I just want to comment on something Steve said, which is he said something that is just completely false. I mean, he argued that there are many businesses that are already moving people to put them into the exchanges. There aren't any exchanges. These aren't even set up yet. And what he said is possible that it may happen, but it certainly hasn't happened yet. And that's just a bald-faced lie.
Well, but wait, a lot of these, as you know, a lot of these companies have made this announcement that they are going to move as soon as this program is set up.
Just name the companies, Steve. Name the companies.
But here, let me make a point, though, about your. Let me make a point about your claim about the fact that people.
Hold on, let Steve respond.
No. Let me address your first point, though, about the fact that the Obama plan doesn't move people out of the plans that they want. We know that's going to happen, and the reason that's going to happen, Allison, is because President Obama promised that his plan was going to reduce premiums for health care plans by $2,500 a year. In fact, what's happened since the Obama plan passed was that the health care premiums have increased by $2,500. And here's the reason that people the businesses are going to drop their plans. They can't afford it any longer because Obamacare was supposed to reduce costs, and it's increased costs.
Simon, and by the way, I mean, in keeping with what I think Steve was saying, the CBO itself predicts we see more companies in the future drop their health benefits, follow the lead of Sears, and let their employees buy the coverage through those exchanges.
But Sears agreed, but Sears is not allowing them to buy them through the exchanges. This is a group health effort because the exchanges don't exist. This is completely unrelated to the Obama health care reform in the sense that they're not dumping people into the exchanges.
This is an exchange that was set up by Aon Hewitt under the guise, but the reality is that if you're going to empower these employees of Sears or Darden, they might as well put slot machines in their lobby as opposed to giving them the kind of information they need. If people were smart enough to make those kinds of decisions about what benefits they need to buy and what doctors they need to choose, we wouldn't be having this debate today.
Well,
and the reality is that we have not. Doctor, what you're basically saying is people are too stupid to make these decisions. No, I think we have. No, we haven't. We have not empowered them with the right information.
But they can get that information. We have plans right now, for example, with high deductible plans, health savings accounts that actually have saved boatloads of money. There's a new study out that shows if you increase these plans, you could save about $50 billion a year.
Measure. Gentlemen, obviously we could talk about this for a long time. You've all made great points. Steve Moore, Dr. P, Simon Rosenberg, thanks so much for coming.
Thank you.
Thank you.
All right, a high school cheerleading squad heading to court